Hello, everybody. Welcome. It's such a pleasure to see so many familiar faces here and to meet some new ones. And we're kicking it off today talking about everyone's favorite topic, sex. And even digging a level deeper, we're going to talk about sperm. So let's keep it spicy. The topic today is actually on male reproductive health. So often we think about fertility as a woman's health problem, but we know that it takes two to tango. And among me on this stage today are some of the foremost experts in the field. So I want to start by kicking it off with Khaled over here to my right, the founder of Legacy Health. Are we experiencing a spermpocalypse?
Spermpocalypse is one way of putting it. Spermageddon is another. Sperm count 0 is my preferred term of choice. The reality is this: sperm counts have gone down by 50 to 60% over the past 40 years. That already in and of itself is cause for concern. A meta-study came out, I believe, last year showing that the decline in sperm counts is actually accelerating and is now looking more like 26% each decade versus 10% each decade over the past 40 or 50 years. And so if you follow the trend, not only is it accelerating, but it's very clearly moving towards sperm count 0. And of course, we can't predict exactly what's going to happen to sperm. And the reality is, in our industry, we often say it only takes one. So of the typically millions of sperm that are produced, it only takes one, which you can usually use for assisted reproduction. So it's unlikely that we will become functionally infertile as a species. However, it is extremely possible that we will be, within a matter of just decades, in a world where we are unable to conceive naturally and have to use assisted reproductive techniques.
Speaking of assisted reproductive techniques, Dr. Brian Levine, who is a good friend and the founding director of CCRM in New York, you live and breathe fertility care. How often do you hear patients coming in and asking about male fertility, or is there still a perception that this is a woman's health problem?
So the entry point of coming into a fertility clinic typically is the female partner. And we actually call the male partner the silent partner. Because frequently people think, okay, my friends are having trouble getting pregnant, let's go check my blood work, let's go get an ultrasound. And then everything looks great. And they're like, we're perfect, there's nothing wrong. And it's only then when I say, well, look, you gotta get your boyfriend or your partner or your husband to come in and get them checked. And the question is always, why? And what we have is like an education problem here, right? People actually don't understand that 1/3 of the time it's a female problem, 1/3 of the time it's a male problem, and 1/3 of the time it's combined together. And one of the issues that we've seen actually after the pandemic, because so many people now access their fertility doctors through telemedicine, where you'll have the male partner on the screen, but then getting the male partner to come into the clinic to get testing is a problem, which is why Legacy is such a big deal, because we're actually able to get people at home testing, and we're identifying even earlier that people have fertility problems on the male side.
So once a family gets pregnant, they go and see their OBGYN. So Dr. Neil Shaw, who is not only a leading OBGYN, but also the chief medical officer of Maven Clinic, who, in full disclosure, I am on the board of, so don't mess up, Neil. Maven Clinic is known for women's health. Why the interest in male fertility?
Thanks for the question. So first of all, I think this is not how it should be, but it is how it is. Male fertility has become a women's health issue. For all the reasons that we've been talking about. Men are the silent partner, but they're half of the diagnostic equation, and usually women have to carry the treatment burden. But I'm really coming at this as both a man and as a feminist, and there's not a shred of doubt in my mind that women are suffering disproportionately and made vulnerable by a system that's not designed for their needs. And also, men deserve a lot more of our empathy than they're getting. Men don't engage with primary care, they don't engage with mental health care, they definitely don't engage with reproductive health care. We talk about sex, Dina, but we don't talk about fertility. And we live 5.5 years less long. And I think the reason is, as an OBGYN, I've been thinking about this, like women have a cyclical event every month that's tied to their fertility and actually tied to their overall wellness. And so if a woman has an abnormal period, that could be a signal to go see a doctor, but men have no equivalent check engine light. And I actually think one of the most important opportunities we have to improve not just men's health or women's health, but population health, is to figure out how to engage men better. And I think there are good ways of doing this and very bad ways of doing this. So I'm hoping that we're going to get into that a little bit.
Absolutely. Pam, as the woman on the men's fertility panel, tell us a little bit about the work that you lead at Posterity.
Yeah, so thanks for having me. We're really focused on making it easy for males to seek treatment and get the support that they need if there is a male factor involved. I think one of the big things we are working with this team on is awareness, because it starts with the testing, and we want to make sure that when males do have an abnormal semen analysis or a fertility issue, it's comfortable and it's easy to see a very scarce group of reproductive urologists. I think many people don't understand that 50% of the time there is a male factor issue, and in most cases, sperm quality can be improved. So we want the male to feel like they're part of the reproductive journey and that it is a couple's journey.
And audience, we will be turning in a few minutes to you for questions, so start thinking through them, and we'll have folks coming around with mics. But in the meantime, I want to double click on this question of sort of the cultural stigma and bias. And Khaled, this is something that I know you in the early days really focused on breaking, and you've now made extraordinary breakthrough partnerships with groups including the VA. You've brought some celebrities on board. Tell us how you went about making sure that you could actually reach men and have their ears.
Thank you. It's a phenomenal question. When it comes to sperm, I mean, your sperm, for someone who has it, is in many ways how you define your virility, potentially your masculinity, right? And so how do you approach a topic where you're telling people, hey, have you thought about testing your sperm? Have you considered whether you are fertile, subfertile, or potentially infertile? Have you thought about what this might mean for your future desire to have a child? Now, I want to take you all back a few years to when I'm in Coronado, California, and I'm presenting to the Navy SEALs about their sperm. Please imagine the room of 50 freshly graduated Navy SEALs, any one of whom could have snapped me over their knee in any moment. And I'm sitting there, and you can imagine the kind of jokes that are coming out of that, right? You're telling me to do what with my jizz, right? You're telling me to do what, where, right? But by the end of that conversation, they realized that sperm was not just something for them to joke about. And what we often say is that sperm is funny until it's not. And so in this world, you have to approach sperm from a clinical perspective, make it clear that it's serious, and what you will learn very quickly is that someone will match your tone. If you're going in there and you're cracking jokes about sperm, believe me, there is nothing more that any man wants to do more than make jokes right back at you. But if you go in there and you're talking about sperm in a serious way, as a serious topic, they will match your tone, and that's true for a couple that's struggling to conceive, just as it is true for a Navy SEAL or a man in the military, people who you would typically think of as being kind of the quote-unquote very masculine folks who don't want to talk about more serious healthcare topics. And so all that to say, when it comes to the way that you approach this topic, the branding of the topic of a topic like sperm, you have to come at it in a way that is approachable for someone who's in the military, in a very serious and masculine way, but also approachable for someone who's struggling to conceive, where there's a lot of anxiety and mental health that goes into that as well.
Absolutely. I want to talk a little bit about the role of technology, and we talked a little bit about assisted reproductive technologies, but in a problem that is very much biologic, there are also some interesting deep technology applications that are out there, and from telemedicine to AI-assisted IVF. What are some of the technologies that you are most excited about? Perhaps I'll start with you, Pam.
Yeah, I think we're starting with the basics, which is creating a digital patient experience so males can, from home, not only get tested, but have their first encounter with a specialist, making it a very convenient experience, and really being able to automate the whole process, making it easy for them to stay compliant. We're doing some early work with AI to really trying to understand who are these people and how can we help them, how can we find them proactively, and what type of issues can we attack really at the fundamental level to start changing things. You know, crazy things, 10% of our patients are on testosterone, which stops sperm production. So can we find those patients? 40% of our patients have hormone deficiencies. Can we find those patients? And using AI to get that data allows us to really help people proactively.
Brian, you're pitched all sorts of technologies at your clinic. How do you separate the wheat from the chaff?
So I ask about the utility and actual function. So back to sperm, what a lot of people don't realize is that the world's smallest surgery, and you can all go home and tell your friends this, is actually injecting a single sperm inside a single egg, right? So the sperm is the smallest cell in the human body, the egg is the largest cell in the human body, and something called ICSI, or intracytoplasmic sperm injection, where we inject a single sperm inside a single egg, world's smallest surgery. Done by embryologists who are scientists, but there's a problem. We grade that sperm morphologically or by vision on how pretty they are. But pretty sperm does not mean pretty DNA. And so when people pitch me on their technology of doing better ICSI or doing better fertilization, I say, well, is that a better baby? What is the outcome of measure here? And I think that's what we have to look at right now, is we're looking at all these different technologies and all the things that we're looking to invest in or deploy in our own clinics. And to me, if someone can say to me that if a woman only has a finite number of eggs and a man's going to produce millions of sperm, how do I identify the right sperm so that I don't waste her eggs? And that's what I'm hoping for to find one day.
Yeah. Before we turn to the audience for questions, Neil, I want to talk a little bit about health equity in the context of male health and male fertility. And you and I have spent a lot of time talking about the Black maternal health crisis and how women of color in this country are 3 to 4 times more likely to die in childbirth. But even less discussed is the impact of underrepresented communities in the context of male fertility. Can you share a bit about your perspective on that?
Yeah, sure. I mean, I think, so at Maven Clinic, we don't have a waiting room. Like, I don't have a captive audience. So I earn the opportunity to make people healthier by engaging them in the right way. And I think something that Legacy has proved out is men are very interested in their sperm. You know, you don't, pretty much since we invented the 300x zoom lens, the first microscope, we've been looking at sperm. And it turns out sperm is very, very sensitive to almost everything that we care about. So if you think about what we put women through for pap smears and mammograms, sperm is a pretty decent screener for testicular cancer and prostate cancer. It's not perfect, but neither is a pap smear. It's very sensitive to metabolic health. You know, I'm an Indian man, so I'll probably be on statins in a couple of years. But when I look at my cholesterol, it's just letters and numbers. It turns out it takes 6 months of changing my diet to see an impact there. But sperm, you know, I ended up quoting somebody in a deep dive that we did recently into sperm who said that their sperm went from being a graveyard to a rave based on changing their diet. And it turns out we actually do have a monthly event. We generate sperm every month. And within a month of changing your diet, you can see that improvement. And potentially, as Pam was saying, avoid all that IVF. The way this ties back to health equity is that almost every condition in public health, we see massive disparities along geographic lines, along racial lines, and all of these things are sensitive to fertility and sperm. So I actually think every man should probably get a semen analysis, not just, and now especially because we have the technology to do it at home, preferably with you know, a human being to help interpret it, and then ideally to connect them to primary care.
All right, I promised audience engagement, so we'll start with the first question, and looks like we've got one over here from Nick.
Hey there, Dina. Hey there, I'm Nick St. Fleur, I'm with STAT. So my question for you all is kind of, what is the big why behind Spermageddon? There was an earlier session where one of the panelists, Dr. Jane Van Dis, was talking a bit about a study where they found microplastics in the testes of men. What exactly does that mean in this conversation? And also, as a guy who is a young guy who's, you know, considering having kids, what can I do to, I don't know, take better care of my sperm?
Who wants to take that one? Khaled.
Oh, I would love to. First of all, young, good-looking man, freeze your sperm, my friend. freeze it right away. Look, I have theories from the conspiratorial all the way to the more science-backed. I'll start with the more science-backed, which is the level of chemicals, phthalates, BPAs, forever chemicals in our bloodstream is terrifying. The FDA found that every single American has a measurable level of phthalates in their bloodstream. A study that came out, I think, today or yesterday found that in a study of 50 men's testicles, every single one of them had forever chemicals that is in their testicles, in their bloodstream. This, to me, is terrifying, and from my perspective, having been in the field for some time now, is the main reason why sperm counts are on the decline, why testosterone levels are on the decline. It's very likely that chemicals are actually causing all of this, and the regulatory landscape is so far behind where it needs to be.
So what can folks like Nick do?
So I'll tell you from a very biased perspective, because I run a company that does sperm testing and sperm freezing, and we let you do it from home. I'll tell you what I did when I was 26. I froze my sperm. I tested it, I froze it. That is the best semen sample that I have ever produced. I am probably the most unhinged person ever because on LinkedIn a few weeks ago, I actually posted my semen analysis results over time. And you can actually see, first of all, the overall quality declines over time. Second of all, when we're fundraising, my semen analysis scores plummet.
It's very sensitive.
But it is specific.
A couple months after we're done, where I'm on the beach, you know, in the south of France, they shoot right back up. And it's testament, first of all, to the fact that the older you get, the more your sperm quality declines, the more DNA damage in your sperm accumulates, the more likely you are to have an unhealthy pregnancy, a child born with congenital conditions. You don't want any of that, especially in a world where chemicals are making us all infertile. So what I would say is freeze your sperm now while you're young, good-looking, and healthy.
There you go.
So listen, so Nick, me and Khaled have a little bit of difference of opinion here. So I don't know if I subscribe to the sperm count zero hypothesis. I'm worried about the environment. I'm worried about toxins. And it's definitely clear from the evidence that toxins have an impact on fertility. What we're seeing, though, across the world is that fertility rates are declining, right? And we're all reading about that. And my personal take is that it's a sociological phenomenon as much as it's a biological one. And it's something that we're going to have to contend with on multiple levels. I think fundamentally where Khaled and I agree for sure is that every man deserves a semen analysis, probably on a regular basis, to have a better understanding of their health picture. And probably what you'll find is that your sperm is more sensitive to being in the south of France versus being in a fundraise than necessarily the environment. But those things really matter during the moment where certainly you want to build a family, but probably they matter in terms of the long term of your health, because probably from your semen analysis we can figure out, are you on the pathway towards developing diabetes? Are there other sort of things going on in your environment that we can correct for to make you a healthier person?
Yeah. And I would add there are tremendous lifestyle and behavioral changes that we all can make that impact semen analysis results in overall health. Diet, obesity, smoking, marijuana, all of those things have a dramatic impact on sperm production and sperm quality. So there are things we can take on ourselves.
Yes.
Hi, Sarita Finney with Bayer Consumer Health, and at the risk of TMI, as someone who didn't make her babies the old-fashioned way, I salute you innovators. So on one hand, you've got Spermageddon and sperm count zero. And on the other hand, you've got a political environment that's attacking assisted reproductive technologies. So what role does public policy have? You know, how are you looking to shape it? Any comment on that?
It's a great question.
I'll go straight to
Ryan?
Neil.
So I don't think actually the political system is attacking assisted reproductive technology. One of the fastest political about faces I've ever seen was probably in Alabama. It took 2 weeks. That being said, what I am concerned about politically, and this goes back to how we engage men in their health, which is, I think, probably the most important conversation for us to have. There are many aspects of male identity that are online. One of them that's quite popular pegs declining fertility to the feminization of men. There is networked misogyny out there, and I think all of us who are interested in supporting men and improving fertility have to be very mindful. Because I think actually, Sean Duffy put this very well on the first panel. In order to support people, you have to meet them at their truth and then connect that to something that can help them. And nobody is a monolith. They have multiple truths. But one of the things I'm very worried about is this weird intersection of politics and fertility, especially as fertility rates are going down, and it becomes increasingly a global political issue.
Yes.
Harvey Karp, happiest baby, but this issue of unexpected intersections, I think, is really important. And men, of course, there's a lot of thinking about your testes and your sperm, but there's another connection between the sperm and the brain, which, as a pediatrician, is concerning. And I think as we're thinking broadly about healthcare, and that is the increase in neurological disorders in young children. And we've seen the number of children with autistic spectrum disorder go up and up every year. It's about 1 in 26 boys. Now it used to be 1 in 100, and before that 1 in 500, and before that 1 in 1,000. And the reason I'm just bringing this up for conversation is that The phthalates and chemicals like that, which are endocrine disrupting chemicals, are primarily estrogenic, which may have some inhibitory effect on sperm and testicles. But in the CNS of a developing baby, they have an androgenic effect. And so they may indeed be accelerating attention deficit or autism, which are primarily male disorders. So just as we're thinking broadly about it, it really becomes much more compelling besides freezing sperm, but really trying to reduce the poisoning of our population.
Go ahead, Khaled.
I'd love to comment on that, and thank you for the note. One thing we don't talk enough about is not only, first of all, we talk about fertility as a women's issue, which is a point of view that is outdated and is wrong, to Brian's earlier point, but actually we don't talk enough about advanced paternal age, and that's older dads. And when you look at the stats around just how much DNA damage accumulates in your sperm as you get older, and the kind of negative outcomes that has, both on the pregnancy as well as on the partner, as well as on the child, that's everything from gestational diabetes risk to the carrying partner, all the way through to a number of congenital conditions, autism spectrum disorder being one, bipolar disorder being another. I mean, the list is actually quite long. My personal theory is that part of the reason for the rise in rates of things like autism spectrum disorder is actually that we have older dads, to Neil's earlier point around how we're just having kids later in life. And in fact, one of the biggest challenges we face in the world of male fertility is that celebrities are having kids, much, much later in life. I mean, Robert De Niro, I think, just popped one out. I mean, well, his partner did, but you know what I mean, right? And I think he was 79. But what actually gets grossly underreported is just how many older celebrities who are having kids at an older age actually have children born with these types of congenital conditions. So I think it's widely underreported, underdiscussed, and understudied is older dads and advanced maternal age.
And we have about a minute left, so Brian, maybe a final comment.
So I was going to say, there's one other thing we don't talk about, which is what happens when you have bad sperm. So we actually have a shortage of sperm donors in this country that we actually do not discuss. So for single mothers by choice or couples that have profound male infertility, where you actually cannot surgically extract sperm or induce sperm to be formed through hormonal therapies, we actually have a shortage. So we actually only have about 1,200 active sperm donors in the entire country of America right now.
Wow.
So if you want to go find a black donor or a Jewish donor or a Middle Eastern donor or an Indian donor, good luck, because there's less than 5 of each of those today commercially in the banks that are available. And what that means in plain English is that we need to work on our sperm health because we actually don't have a life raft to help other people find a viable sperm source for the baby that they hope to have.
All right, well, this brings us to the end of our session. I want to thank my panelists and thank all of you.